Phew, recovering from COVID, what a pain in the butt, right? So let's talk about two mushrooms, what they mean from a Chinese medical perspective, and how they may help you with your recovery after having COVID. Hi, I'm Kim from Best Acupuncture. I'm a licensed and practicing Chinese medical provider focused on making Chinese medicine more accessible to you and helping you to help yourself so you can help the world. And if you're new here to the channel, consider hitting the subscribe button down below and the bell up above so you don't miss any future episodes. I've got psycho.
Mushrooms. You know, there's some themes with mushrooms. The lungs are a theme in mushrooms, so healing and strengthening the lungs. And another theme is cancer support. You know, there's a lot of research showing mushrooms can help slow down the growth of cancer cells, especially for lung cancer. And then there's repairing and boosting your immune system as a third theme. And there's a fourth theme of increasing longevity. Four themes: lungs, cancer support, immune system, and longevity. And even though I'm only touching on two mushrooms today, it seems these are general themes across most mushrooms.
Okay, let's go pick up those mushrooms.
Whoa, really wet out today.
Ningxue, or the reishi mushroom, is thought to enhance the spirit and increase longevity. And in ancient China, there were poems, there were paintings, there were legends that honored the reishi mushroom. Yet in the wild, these mushrooms are hard to find, so only the nobles could afford to eat them. Today, the reishi mushroom is the Ganoderma species, and there's a lot of different types of Ganoderma species. So is one better than the other? Probably not.
Okay, so then what are some of the medicinal benefits in traditional Chinese medicine? You know, the reishi mushroom, it helps with anxiety and nervousness. So in Chinese medicine, they call it calming the spirit. And the other thing that it does is it helps build the blood.
Okay, so why is building the blood important and what does it mean?
Things like anemia fall under the category of needing to build the blood. So building the blood is about getting the proper nutrition into the blood. And when you look at anxiety and nervousness, weak blood can be part of that. In Chinese medicine, the heart channel is usually involved in anxiety and nervousness. And guess what? These emotions become more pronounced as you age because you're wearing yourself down.
And Ningxue helps preserve your health by nourishing your blood and rebuilding your vitality. So, curious about vitality?
Check out my blog on what is vitality and why normal signs of aging are not normal. And if you're on your phone or your laptop, you can probably find a link up here in the corner, or you can check down below in the video description. Now, talking about the heart channel, Ningxue is one of two commercially grown reishi mushrooms in China. And you're going to see a red or a black Ganoderma. The red species is going to benefit the heart channel more, and the black species would have more of an advantage on the kidney channel.
So reishi mushrooms weren't really a mushroom that I kept in the office until recently. So what changed and why am I using them? Well, I started using reishi mushrooms in the office for some of my post-COVID patients because, some of you get to experience the soul-sucking Harry Potter Dementor COVID. The one that sucks out all your vitality and happiness. Well, Lingsha does the exact opposite. It actually nourishes and preserves your life.
And I would use a combination of both red and black because, in the end, you always have to rebuild the kidney channel after COVID, and COVID likes the heart.
Like all things, there's different levels of quality. And in China, Chinese herbs are serious business. So your best bet, or if you want your best quality, purchasing a medical grade Chinese reishi mushroom Organoderma is going to be your best bet.
Yet in the US, there's still another option. It's a limited option, but it's still available, and that's to purchase the wild forage reishi. Now, the wild forage, they're even supposed to be healthier than any of the commercially grown reishi. So just a thought. And this mushroom, you're not really going to cook with it because it's too woody. And you could try cooking with a fresh young Lingsha, but it's probably not going to be too tasty. So use it as a powder, or like these dried pieces, make a tea out of them. And here's the rules. So making Chinese tea, bring it to a boil, then simmer it for 30 minutes. And if you're using these dried herbs, you can make 3 separate batches from the same dried herbs.
Cordyceps is another powerful fungi, and this one helps with both the lungs and the kidneys. And what I really like about this one is it helps put yang back in the body. And you're probably wondering, okay, what's yang? And when you're chronically exhausted, well, that's lack of yang in the body, and Cordyceps helps put that energy back into the body. So, Cordyceps helps with more than just energy in the body. It can help with that chronic cough and wheezing too. So this is another fungi that I didn't keep in the office until recently. So what changed? Well, that soul-sucking Dementor COVID. And how can this help? Well, the lungs are always harmed in COVID, and wheezing and a cough are pretty standard post-COVID.
But there's another part to this. In Chinese medicine, there exists this relationship between the kidneys and the lungs, and part of your ability to inhale is dependent on your kidneys. And you can test this out. Go run around any convalescent hospital and ask the patients to inhale and exhale. Then ask them which one's more difficult. If the inhale is more difficult, see if they have any issues with their kidney function.
In Chinese medicine, the soul of the physical body is associated with the kidneys. And I keep on meaning to do an episode on the kidney symbolism and what it means to your physical life, because it's just so interesting from a spiritual perspective. But between the kidneys is the Ming Men, or the gate of vitality. And that is your spark of life, or the burner that keeps your life going. And it's associated with the kidneys.
This had me thinking about the umbilical cord. I mean, why is it located where it is? It could be located anywhere on the body, but it actually sits between the lower half of the 2 kidneys. And this doesn't mean that it's the Ming Men, because Ming Men was created when the egg was fertilized, but the umbilicus fed the Ming Men during the pregnancy.
The Ming Men, your capsule of vitality, is what that soul-sucking Dementor COVID goes after. And it's part of the reason why it's so difficult to recover afterwards. And it's also part of the reason why some people can't get rid of that chronic cough, because that cough, it's not coming from the lungs, it's coming from other areas of your body that are weak. And that's the other thing about those who get COVID symptoms that last or get progressively weird afterwards. They go through all these Western medical tests and everything comes back fine. Everything comes back great.
There's been this hesitancy to prescribe medication to post-COVID long haulers because their tests look fine and people sometimes get worse when prescribed medications. So, blood pressure medications are a really good example. Long haulers that I've worked with that experience sudden high blood pressure have felt awful on blood pressure medications. And you know what? The meds didn't seem to be able to get the blood pressure under control. And I had to think about it for a while. Our medication is focused on the organs and modifying some function of the organ. But what happens if these symptoms are not coming off the organs? In aging, things slowly stop functioning, and the life essence that allowed everything to move has been fading away.
I remember my first real exposure to this concept with my mother. At the end of her life, she got pneumonia, and they put her on intravenous drugs, intravenous antibiotics for 5 days, and it had no impact. And I had to ask the doctor about it because I was shocked. I really didn't understand how that could happen.
The doctor said sometimes the body just doesn't have any immune system left, and no matter what medicine can do, the patient still needs to participate. And before this point, I really had thought the antibiotics, especially intravenous antibiotics, would work separately from the body. And I thought they didn't need us to work. So imagine how shocked I was to find out I was wrong. So when the Ming Men goes out, there's no magic bullet. You want to be a little bit proactive with your Ming Men and not let the kindling that has been keeping the fire burning run out. There's this part of being human that Western medicine doesn't address. And if you think of your body as a layered cake, there are only a couple layers that Western medicine can address. With the most commonly addressed layer is the changes in organ function.
Your body has more than one layer. So when you try to fix a problem with a solution from a different layer, you don't succeed.
If you take medication for an issue you don't have, you're going to force your body to do something it doesn't need to do. So you're going to feel worse. And the Ming Men is this energetic layer that stores the vitality you were given at birth. Yet COVID seems to be able to find it and seems to love to snack on it. And by snacking on the Ming Men, COVID takes away that vitality that differentiates youth from old age. Suddenly, you've aged 20, 30 years, and your doctor's confused why you're showing symptoms of someone much older.
So getting back to cordyceps, one of the things that cordyceps can do is put the kindling back under the Ming Men. And you want that kindling back under the Ming Men because the health of all the rest of the organs in your body is dependent on the fire of the Ming Men. So cordyceps can help put that yang fire back into your body. And that chronic cough, well, one of the reasons why that cough can be so chronic isn't because your lungs are weak. I mean, they could be, but that's not necessarily why you've got this chronic cough. It's more because the Ming Men's weak and it can no longer support the kidney's function or the kidney's participation in helping to pull down the air.
This one you can make into tea also. And I haven't found the dried herb. I've only been able to find the powdered herb. And when you're looking to buy this, it's the same thing as a reishi mushroom. There's going to be different levels of quality. So if you can purchase a medicinal grade cordyceps, that's going to be your best bet.
Okay, there you have it. 2 herbs that help you find your energy post-COVID. And you've got to take these for a really long time, so consider taking them for at least a year. And if your situation is more complicated than just trying to get over your cough or get your energy back, then give the office a call and schedule a tele-appointment. You can find a link in the video description below. Okay, until next time, I'll catch you on the other side.